So right now we're talking about medial and lateral epicondylitis, aka elbow pain that's on the inside or elbow pain that's on the outside. Outside's lateral epicondylitis, this side's medial. This side's also known as golfer's elbow. This side's also known as tennis elbow. So right now I got a patient who reached out to me, an old patient of mine, and she's having some pain in her middle finger. And so she's also having some trouble closing her fist. And so what I want to bring up is that basically what can happen if you're having some trouble closing it is that there's myofascial restrictions on the back side of your arm. Okay, and so if these obviously are tighter, they're going to create a lot more resistance as we're going to use the opposite side. Okay, and so also she's having middle finger pain, and we know from this trigger point chart right here that what happens when, come on in so you can see this whole thing. The X is where the muscle gets restricted, and if that muscle gets tight enough there, it's going to cause pain down in the back of the hand. So this would be for, this is more extensor carpi radialis, which is going to go to the back of the hand. This muscle is probably a little bit more along the lines of what's going on here, which is the extensor digitorum, and it's creating middle finger pain. See how that darker circle is on the middle finger? And extensor digitorum, which is basically the way we extend all four fingers. That muscle for the middle finger is just locked way too tight from, I don't know if she's lifting weights or doing reverse curls. That's really the main reason why people get things like this, or also pulling early on the clean, things like that, or working the back side of the arm too much. Maybe a lot of typing. And typing can be toxic for muscles too. It creates a lot of insult because that's a lot of repetitions per day, not a lot of rest time, and that can cause muscle tightness in itself. So what I wanted to show you was how to use this very cheap little tool, which is for cupping. Okay, this is a silicone cup, and somewhere in this video description I'll put a link to this product. But this comes with 5, and each one's bigger and bigger and bigger. This is the smallest one on this set. This whole set was only $26 for 6 cups, so very affordable. So what I'm going to do is I'm going to realize that extensor carpi radialis we talked about, which goes from the outside of my elbow to my radius, and the extensor digitorum, specifically the one for the middle finger, which goes right down the middle. All these muscles are mostly here. These are mostly tendons down here, so we're not going to work this. We're just going to work basically this triangle right here. And so what I'll do is dab some lotion on, get it nice and wet. I have a lot of hair on my arm, so I'll need it to be a little bit moister than normal. Okay. And then it's nice to go in ahead of time and find out which actual portions of the muscle do feel super tense. And if you find them, that's where we want to kind of spend the time with this cup. Okay, and when you do cupping, you really got, on these, you really got to squeeze that thing, because now it's drawn in all my skin. I don't know if you can see that. See a shot of it, it's drawn in all the skin. It can't just be sitting here lightly like that. We really got to depress this whole thing and get all that skin up in it, just like that. And so from here, basically all I want to do is wiggle, find where it's kind of tender or it hurts, or remember like we found the muscle change where it felt like a piece of wire in there. And if we find it, we want to kind of do circles around it. And I just mean like this. We're just kind of sliding like this. What you could also do is go up and down it. It's really, mobility or tissue mobilization is really about any manner of forcibly and mechanically separating the tissue fibers so that blood can get in and waste can get out. Because right now the muscles lock so tight that oxygenated blood can't get in that muscle to heal it. And there's constant use, so the muscle's constantly getting tight and staying tight. So this is going to be creating the opposite effect because it's drawing in, it's creating like a kink in the fascia, and then we slide the kink around, and what happens is, you can hear how the air's coming out because I'm too hairy. basically we create a kink in the fascia and then slide it around, and the net effect is taking that fascia that's all bundled up and spreading it out. That way the muscle can breathe. And so I'll just show you a few more techniques of what I would do here. This whole procedure would maybe only last 6 or 7 minutes. And I'm really drawing it in and I'm moving it all around. And if I find somewhere where it gets hung up on me, there's not many spots, but maybe I'll leave it there for 1.5 minutes or 2 minutes. And because we're doing cupping, you could have some pretty dark bruises after that, but they're not bruises in the normal sense of mechanical trauma, ow, that hurts now to touch. They're more bruises in the sense of it's drawing out toxins and it's bringing them to the very surface of the skin. So it's more of a discoloration than a bruise in that sense. And they're not going to be tender. You're not going to have to worry about them. They're probably not going to be sore either. So it's a really cool way to knock it all out really quick. By the way, you could have done the same exact thing on the inside of the elbow. There's muscles that go from here, basically across from this bone to the radius, from here all the way down the radius, from here to the ulna, and just straight up in the wrist. So you could have done this if you're having pain on the inside of your elbow too. Okay. That being said, there's also a nerve in here that goes and creates pins and needles right here on these 3 fingers, the median nerve. And so if that's what you're having is pins and needles, and maybe some weakness in your hand, maybe you treat that median nerve by doing exactly what we're doing here. Also, if you're having some numbness and tingling on the back of your hand, all these digits here are going to basically on the back side mean that your radial nerve is potentially being entrapped by the supinator muscle, because it is a fact that basically on each instance your nerve will go straight through a muscle, and if that muscle is real tight, it's going to create different changes in sensation in that nerve in your hand, not in the arm itself but in the hand. So again, this is what you could do if you're having pins and needles on the back of your hand. And so that's really all we want to do. We want to hold it on the areas where the adhesion was. We want to go through and kind of break up that fascia. Should almost feel good. I mean, this doesn't hurt. This almost feels like a cool massage. And should be getting near the end of our treatment time by now. But this is where I would start if I wanted to try to, I can't even get it finished. This is where I would start if I wanted to try to self-mobilize medial or lateral epicondylitis. Okay, good luck with that.